welcome everyone. It's a pleasure to have you here with us today as part of our newer programming this year, Open Access, brought to you by Open Houston. As many of you will be familiar, Open Houston's mission is to advance the Houston entrepreneurship ecosystem within the wider diaspora of this wonderfully diverse city. We do that through a variety of programs connecting entrepreneurs, innovators, and investors through our annual conference and regular programming like this monthly talk series. Open is a chapter-based organization. Other chapters include Silicon Valley and New York, and each chapter is steered by an esteemed group of charter members, some of whom are with us today. And for these charter members, or CMs as we like to call them, through their success, they help guide the vision and programming to enable the sharing and creating of opportunity beyond themselves. So we thank you guys for all that you do. We'll do a couple of things. We'll just take a quick peek at some of the upcoming events. I'll do a little housekeeping in terms of how we're going to run things today. And then, of course, we're going to get over to our wonderfully esteemed guest, Dr. Brittany Barreto. What we have is on April 29th, we have Dr. Ghazal Qureshi, who's going to be part of our Women's Leadership Series. She's going to be talking about how she is leveraging AI and machine learning platforms in the STEAM education space. And then on May 13th, we're going to be talking with Dr. Khalid Mahmood. He's based out of Dallas, and he's going to be talking about his lifetime of entrepreneurial work across a variety of businesses, both in and out of the healthcare space. Today, as we go through our session, we're in general, it's a very casual environment. As you guys have questions, feel free to raise your hand, pop it into the Q&A. I'll go ahead, I'll help facilitate that back and forth and that dialogue, but really casual, so feel free to want to chime in anytime. Dr. Barreto is going to kick us off. She's going to talk about her journey. She's going to be talking about the awesome work that she's doing in this emerging space of FinTech as well as some of the exciting ventures going along with that, including investments along with the industry in general. Dr. Brittany Barreto is not a stranger to Open. She's been with us for quite a while and connected us in a variety of different ways. She attended Rice and did her doctorate in genetics. She founded Fairmore, a genetics-driven dating app as well. From there, she introduced actually Open and why am I going blank on the name all of a sudden? Yes. Sorry, say it one more time.
Capital Factory.
Yes, obviously, duh. She introduced Capital Factory and Open. As you guys may know, Capital Factory is one of the largest accelerators here in Houston and one of the largest seed investors, in Texas, and one of the largest seed investors here in Texas. And since working with Capital Factory, she's busted into this awesome space of FemTech. She has her podcast, 30K downloads already with over 130 episodes. And what did you say? I think it was 107 that just dropped, you said? Awesome. And then in addition to that, she is also building one of the largest databases on FemTech companies and deals happening in that space, which is largely uncovered. And you should tell TechCrunch they need to get on top of that. As well as you can tell us more about it as well, but starting a new venture and investment site through Coyote Ventures, which is a $10 million venture fund investing in seed stage women's health companies. Today, she'll be talking to us about FemTech, her nonprofit FemTech focus, her new venture fund, Coyote Ventures, and how Open can support her initiatives and improve women's health worldwide. Dr. Barreto, thank you so much for joining us, and may I please hand it off to you.
Yes, you may. Thank you so much. Hi, Open. You guys are awesome. I love this organization. I'm going to just share my screen. Oh, can you stop sharing yours?
You got it.
There we go. There we go. All right. So amazing introduction. Thank you very much. I'm really excited to tell y'all about the new projects that I'm working on, FemTech Focus and Coyote Ventures. And I'm going to tell you how outrageous it is that women's health is actually an emerging market. I couldn't believe it myself until I got into it. And dove headfirst, quit my day job at Capital Factory in order to pursue it, because that's how absolutely devastating it is about the current state of healthcare for women. So we are going to change that. And it's really exciting, actually. So a little bit about my background. I'm from New Jersey. I went to Drew University undergrad in New Jersey. I actually went to Baylor College of Medicine, although I spent a lot of time at Rice. I did not attend Rice, but I went to BCM, got a PhD in molecular and human genetics. I interned with a company y'all might be familiar with, Bala Raj. He was the founder of Luminostics, and that was my first startup consulting job, and fell in love with startups and entrepreneurship. I then attended Inventures BioVentures Accelerator, where I started my first company, Faramore, which turned into the first DNA-based dating app that was nationwide in the States. And that was very, very extraordinary experience. I learned a lot. We raised a bunch of money. We lost the money. The company closed. But with that comes so much experience and wisdom for like how to run a company and what can happen to it. And so I actually spoke in 2019 at your Open Houston conference on a panel about that. And you guys probably have recordings of that somewhere. This little heart here, the purple heart, is because we did have a little Hail Mary at the end of Faramore where we tried to make a couples website called wehavechemistry.com. So if you see that on my LinkedIn, that's what that is. And then I was hired by Capital Factory to launch their Houston branch. And so you may remember about a year ago, I brought Josh Baer and Brian Chambers to y'all for a presentation by them about the Texas ecosystem. Now I'm working on FemTech Focus and Coyote Ventures. FemTech Focus is a nonprofit, 501c3 nonprofit that I started about 1 year ago. We are a nonprofit that's all about empowering innovators in the women's health and wellness space. And the reason it's a nonprofit is because a lot of times we are really educating the masses on the inequalities in women's health. And so when you're doing mostly education and awareness, fits really well into a 501c3 model. We also just launched Coyote Ventures. So we're currently raising $10 million venture fund, Fund One, in order to invest at seed stage femtech companies. So a little bit of my track record there. And I want to jump into what is femtech. And I can't see the chat, but I'm going to open it. And if you have questions, you're allowed to drop them live. I will answer them live. Yeah, there we go. What is femtech? You may have thought this whole thing was about fintech. Please stay. This is not about Bitcoin, but I hope you stay for the rest of this seminar. It's really important. Femtech is not fintech. It is also not female founders. It is innovation in women's health and wellness. So technology, services, and products that improve women's health and wellness. And the reason that we had to even come up with the word femtech was coined in 2016, was because we wish that it could just be called healthcare or health tech. But unfortunately, health tech is based off of historically a white man's metabolism, a white man's body. And so we found, and by we, like the greater innovators of women's health, found that without a word and without distinguishing, we need to look at women's health as its own thing. We oftentimes were not the subject of design for experiments. We were not the, patient that people were making med devices for necessarily. And so that's why we have the word femtech. I hope that we do such a great job at FemTech Focus that we actually lose our jobs, because all of a sudden it's healthcare. But until then, we're going to stand up for femtech. Now, femtech isn't just about periods and pregnancy. It's actually about conditions that solely, disproportionately, or differently affect women. So things that solely affect women, you can think menopause, fertility in terms of eggs or ovaries, menstruation. Disproportionately, you can think migraines. So most migraine patients are women. Autoimmune. So 90% of Hashimoto's autoimmune disease are women, and we do not know why. Bone health, so that disproportionately affects women after menopause with osteoporosis due to the decrease in estrogen. So these are things that disproportionately affect women, and then differently affect women. So heart health. I don't know who here knows, but I grew up thinking that if I was ever having a heart attack, it would look like me grasping my chest because I had chest pain and my left arm would be numb. If any of you think that is the sign for a heart attack for both genders, drop it in the chat. I'm going to surprise you, because turns out the symptoms for a woman is extreme fatigue. And so although men have more heart attacks than women, women die more often because we actually as a society learned about the man's symptoms instead of a woman's symptoms. And so that's how, that's an example of differently affecting women. Also, we have oncology and incontinence are things that affect both, but different in women. Now, 80% of our founders are female, and that's because we're oftentimes solving our own problem. And we're a group that isn't, as weirded out about talking about vulvas as potentially the other sex. And so we are not only female founders, we do have male founders and we love them dearly. We believe that we need every gender working on this problem, but 80% of our founders are women. And you can see here on the bottom of my slide, just different areas of FemTech as well. Now, this is something I call my shocking facts list. So I have a very, very long Google Doc of all the shocking facts of why we should care about FemTech. So here's 6 that I picked for us today. Maternity and pregnancy. Did you know that as a millennial woman, 29-year-old woman, I'm actually twice as likely to die from childbirth than my own mother? Because maternal mortality has increased over 50% in the last 20 years. It's more than doubled. And also, the US is the highest maternal mortality rate of any developed country in the world. Also, Black women die 3 times more likely than white women from childbirth, and Latina women die 5 times more than white women during childbirth. So this is a huge, huge problem. Also, there's about 4 million pregnancies a year in the United States. Half of them, so 2 million pregnancies, are unplanned. So we still need a lot of innovation in contraception because half of the pregnancies in the country are still unplanned. Seatbelt safety. Seatbelts were made for male bodies. It was only about 10 years ago that anyone even made a female dummy for car developers to test with. It is still not legally required that they test it. So all the safety rates about how safe the cars are based on a male's physique, which is different than a woman's physique. I don't know if anyone here has themselves been pregnant or known someone who's pregnant, but that's always the biggest question. How do you put the seatbelt on correctly? So we know the data shows that seatbelts kill women, and yet we're not really doing anything about it. Clinical trials. It was illegal for women to be included in clinical trials till 1993. So any drug that went to market before 1993 had never been tested on a woman before it went to the market. This results in 5 times more symptoms in women taking therapeutic drugs than men. Also, let me give you 2 examples because I always love a real life example. Like, well, how much should I care about this? Well, there is actually a study done on the number of car accidents women were getting in the mornings if they took Ambien. So Ambien is a pill that helps you go to sleep. Turns out women's metabolism breaks it down differently than men's. And so what was happening was women were taking the recommended dose and they were waking up still under the influence of Ambien and statistically significantly getting in car crashes on their way to work. And so it took over 20 years for doctors to finally pull it back and say, actually, women need half the dose. So these are some of the consequences we're talking about here. Alzheimer's, women are twice as likely to get Alzheimer's than men, and we have no idea why. And it is not just because we live longer. That statistic is not comparable. Heart attacks, I gave you that example about the symptoms looking really differently. And then endometriosis. 1 in 10 women have endometriosis, yet it takes on average 7 years to get a diagnosis. And the only diagnostic test that currently exists is exploratory surgery. So the only way you're diagnosed is if they cut open your abdomen and look around. Ovarian cancer, to date, there is no diagnostic test for ovarian cancer. The symptoms of ovarian cancer are heavy menstrual bleeding and cramps, which is often, passed off as just heavy menstrual cycle that month. And so many women do not get diagnosed with ovarian cancer until it spreads somewhere else. And to give you a context of how prevalent that is, 1 in 34 women get breast cancer, 1 in about 70 women get ovarian cancer. So it's pretty prevalent. And last but not least, a vaginal stent. There is no such thing as a vaginal stent. Every orifice of your body, your arteries, there's stents for everything, yet there is not one made for vaginas yet. So those are some shocking facts. let me tell you a little bit about FemTech Focus. We are a 501c3 nonprofit. We are founded to empower, equip, and unite healthcare professionals, life science entrepreneurs, and forward-thinking investors to revolutionize women's health and wellness. You can check it out at femtechfocus.org. There you'll find what we're up to, which includes a podcast. So 1 year ago, in March of last year, decided to start a podcast for fun. Next thing I knew, we had a few thousand listeners in a few dozen countries, and I had some sponsors reach out, and I said, heck yeah, I would love to be a full-time podcaster. And so that's what I've been up to for the last year. Obviously a lot of other things too, but the podcast is really our flagship product. So to date, we have over 30,000 downloads in over 100 countries and over 100 episodes. So definitely check out the podcast. Very highly rated. It's really fun. It's informative. It's shocking. It's funny. It's all the things. So definitely check out the show. We have a virtual community. So by the way, there was no podcast before I started one, a FemTech podcast. This is the first FemTech podcast. Also, the virtual community, there was no virtual community for FemTech innovators previously. So now we built one. We launched it in October. And to date, we have over 1,000 members. It's a great place for finding about news and events, networking, and finding jobs in the industry. We also do a lot of research. So I've actually wanted to start a FemTech fund about 2 years ago. And some very wise people in Houston said, well, that's great, but how many femtech companies are there? Where are they? What are they working on? How many exits have happened? What's the market size? And I realized not only did I not know the answers to these questions, but nobody else knew them either. And so we've really dedicated ourselves to doing a lot of research. We're a little CB Insights specifically for femtech. And so we have, to my knowledge, the largest database of femtech startups. We have and I'm actually going to show you some data about that, the 636 active femtech startups in the world. We have an exits database. I'll tell you about that. And also we've calculated the market size. We offer services, we do consulting and pitch deck creation for femtech founders. And when we also have events. So every Monday night, we have a community event. It's a podcast listening party. We listen to an episode and then talk about it. Every other Wednesday, we have a webinar series called FemTech Fundamentals, helping founders build, launch, and succeed in their business. And we also have FemTech Book Club. So there are books out there on women's health disparities. And so every month we read the book and we invite the author to come and meet with us. This month we're reading Doing Harm, and the author is attending. So that's going to be the last Wednesday. So next Wednesday. So we're up to some really, really fun stuff. Also super busy stuff. Well, remember I said, people said, oh, you can start a femtech fund, Britt, but what about this data? Well, we're now in a position, we have the data. And so we are launching Coyote Ventures. It's a $10 million seed stage venture fund investing in US-based companies innovating in women's health. It's founded by two general partners, myself and my co-founder, Jess Carr. She was actually one of the early employees at Impossible Foods and invented the Impossible Burger. So she's a biochemist and knows about startups and has been recently working at family offices in San Francisco. So we're pairing up and we're going out to market and fundraising. And it's been really, really exciting to use FemTech Focus as our deal flow source, but also our value add to our portfolio founders. So that's really exciting. So I want to dive into a little bit of just seeing who we have some more attendees. Oh, this is good. Excellent. And people who have just joined, feel free to join the chat. Just throw some things in there, even if it's just like, wow, crazy, didn't know that. So 2 ways to slice up femtech. You can either do it by condition or ailment or by product type. So if you slice up femtech by condition, it looks like this. You have reproduction, menstruation, sexual wellness, pelvic and uterine health, bone health, oncology, autoimmune, and brain health. If you dice it up by product, you got medical devices, healthcare software, therapeutics, consumer products, consumer services, and consumer apps. So this is 2 different ways to kind of look at the same beast on 2 different angles. This is recent, which is actually not published yet. So open, you're getting an inside peek. All right. I do not mind if you screenshot and share though, that's totally fine. But we are publishing a paper coming out next month on the femtech landscape. And this is one of the big findings. So typically people cite a study done by Frost and Sullivan about 3 years ago. They estimated the femtech market to be 50 billion, 50. I just couldn't comprehend that, considering menopause is a $600 billion market. Maternal health is $27 billion market. The fem care, feminine hygiene market is 63 billion. And so when you actually add up all of the things that make up femtech, we're closer to $1 trillion market. And so if anyone tells you that women's health is niche, you're going to say it is absolutely not. And you need to go speak to Brittany, because she's going to tell you all the reasons why it's not. How many femtech companies are there? We have about, to the best of our knowledge, 636. We update this every month. I have a small army of interns that work really hard on continuing to scour every newsletter and article that comes out. And we have an active Slack channel. Whenever we find a femtech company, we throw it in there. So we have these interns really validating it. So as of today, 636 companies were in there. You can download the PDF version of this list on our website. So go to femtechfocus.org. You can go to resources and you'll find the link to the PDF. Admittedly, the PDF is not very friendly because we have labored many, many hours over this database. And so if any of y'all are interested in a filterable one, editable one, you can message me and talk to me about prices, because the research that we've done is kind of one of our value adds. I want to kind of break down for y'all what the femtech landscape looks like in terms of what are the startups working on. So I made a graph. I'm a scientist. I love making graphs. So here's a graph showing you what the companies are working on and where there's potential quote unquote saturation versus where there still needs innovating. So let me break this down for you before I showed you the 3 boxes here. So first, let's look at what is saturated. So saturated, 49% of the companies fall into these 4 buckets. The first being menstruation. Second is fertility. Third is maternal health, and 4th is sexual wellness. Now, the reason I put this in quotes, saturation, is because 1 in 5 girls in the United States, I'm not talking about Africa, I'm not talking about Nepal, I'm not talking, I'm talking about the United States of America. 1 in 5 girls misses a day of school every year because she doesn't have access to a menstrual product. So because she doesn't, maybe it's an economic issue, maybe it's her living issue, but she doesn't have a product. So therefore misses school because she doesn't have a menstrual care product. That's 1 in 5 girls in the United States. So the fact that menstruation is the most innovated, most saturated is obviously not the case. Period poverty is absolutely real right here in our backyards. The other piece is if number 3 is maternal health. I already told you maternal health rate death is increasing. It is increasing exponentially, not even just like a bump, like exponentially. So when I see saturation, I think about like not for everybody, especially if you think about who we are innovating for. So healthcare in general has had this really bad issue innovating for the male physiology and then just assuming women were little men, and we're not. I actually think that there is an issue in femtech, which, is being really brought to the forefront, which is that even within femtech, we're innovating for the affluent white woman who can spend $2,000 at an at-home fertility test, or she can spend, $100 on special yoga pants that, make sure her vaginal health is in check. So we're not innovating in femtech all the time for all of the women of every economic level, of every race, of every age, of every religion and language. And so it is really interesting to see saturation not even really being saturation. Areas on the rise. So this is kind of in the middle. We have pelvic floor health, menopause, breastfeeding, healthcare delivery. So what I mean by healthcare delivery is like telehealth services, or Kindbody is for fertility, but they have like a nutritionist, the OB-GYN, the IVF doctor, everyone is under one roof. So it's more of a team approach to healthcare delivery. And contraception. Contraception, interesting story really fast. Evofem Biosciences is actually a publicly traded company You can, get stock in them on the market. They just launched the first ever non-hormonal birth control. It's actually pH moderation. I can get into the science of why pH matters in fertility, but we'll just leave it at that for a second. But unfortunately, pH does not fit the description written by the Affordable Care Act in 2010, which said hormone contraception needs to be covered by insurances. And so Evofem's actually having an issue right now. If their commercials are all over, you might see them on TV for Phexxi is their drug, Phexxi. They are not getting it covered by insurance because the insurance says, well, this document from 2010 said hormone-based contraception. And so it's unfortunate that our policymakers were not forward-thinking innovators about the future of contraception, maybe not being hormoned. We live our lives trying to eat all the hormone-free chicken and hormone-free cows, and yet women are walking around being so hormone pumped up all the time. So really interesting dynamics within FemTech. And then this last slide is about areas that need innovation. They're really lacking. So the two I kind of put little arrows here to is cardiovascular health. Heart disease is the #1 killer of women in the United States. A lot of people think that it's breast cancer because there's been so many, pink ribbons and walks and fundraisers, and the NFL's cleats are pink and all the things. But 1 in 36 women get breast cancer. 1 in 5 women get heart disease. And so the fact that we are not really paying attention to women-specific hearts, because our hearts are, behaving differently, being affected differently, we need to really be innovating it for it specifically. And then ovarian health. Again, there is still to date no test that can diagnose ovarian cancer. So any innovators on the call, feel free to take a screenshot of the slide. This is where I see the need for innovation. So includes pelvic floor health, healthcare delivery. So we noticed during COVID that, women need to get their prenatal visits. And if they don't have telemedicine set up with their OB-GYN, it wasn't happening. And so there was actually a huge spike last year in stillborn births due to the decreased number of patients going to see their OB-GYN for prenatal care. Uterine health, vaginal health, contraception, mental health for women specifically, and then lots of other health like autoimmune or life after cancer. A lot of women have a lot of terrible side effects after surviving cancer. Many people think that, well, they survived, so that they should just be grateful, but there's actually a lot of consequences after, surviving cancer. Some FemTech investors. So in 2019, the only one was Portfolia. Now we have a few other ones. So there's Steel Sky Ventures, Avestria, Astarte Ventures, Ria Ventures, and The Case for Her, which is more of a philanthropic donation organization, and then Coyote Ventures. This is one of my favorite slides and one of my favorite data points. So not only did people ask, are there any exits? They actually assumed that there wasn't. I, to this day, still hear people say, well, once FemTech has an exit, then it'll get the respect it deserves. I'm so tired of that. So we made a list. We made a database of all the exits that we can find, and it continues to grow because we continue to discover there's more because there's been a real lack of, identification over the last 20 years. But we've discovered that in the last 20 years, there's been over 50 exits with a $15 trillion total value. The average exit value is $428 million. Why is that significant? It's significant because the average tech exit is $208 million. So this is more than double the average tech startup exit. So essentially what we're getting at is if you want a return on your investment, putting it in FemTech is a really smart idea because we exit often and at very high valuations. Top 4 reasons to invest in women's health is that it's a $1 trillion underserved market. It's prime for disruption. Only 4% of pharmaceutical research and development budgets are dedicated to women's health. So what that means is that as soon as a FemTech company gets FDA approval, it is acquired very quickly. This happens again and again. I can send you many case studies of it because pharmaceutical companies are not dedicating the early money. but they realized that women's health would diversify their portfolio of, diagnostics and med devices and therapeutics. So there's a lot of acquisition there. Oops, sorry. Number 3, 80% of the founders are female. Again, this is not just about female founders, but it's pretty great that a lot of them are, because female founders have shown to make 2 times more revenue than male founders, 35% higher return on investment, and 22% lower employee turnover. And the 4th is the average exit value being so high. M&A directors are actively seeking to expand female consumer portfolio. Even for our venture fund, we already have M&A representatives from Target to Bayer reaching out to us saying, we want to, be here next to you to get first dibs on these types of things. And this is a graph of FemTech exits. It looks kind of sad. 2021, I should take that number off because it looks like it's going down. It's just because we're only a few months into it. So we are seeing a historical uptick in FemTech exits occurring. Some of the major barriers for FemTech in research specifically is that pregnant women are still not included in clinical trials. Now, one may say, of course they're not. They shouldn't be. Like, that is just unethical and it's so dangerous. But what I argue is that the clinical trial, I promise, is still happening, but it's happening in the world. And we're just not monitoring it or realizing what's happening. And so it's either going to need to happen in a, monitored way, or it's just going to happen in public. There are women right now that don't know they're pregnant getting the COVID-19 vaccine, and I'm all pro-vaccine. I'm scheduled to get my 2nd dose in a few weeks, right? So I'm not saying that, but I'm saying we're literally doing the experiment in public. And we do that for a lot of drugs because no one wants to take the responsibility of testing something on a pregnant woman, but eventually they'll take it. So it's a conundrum there. The FDA has higher barriers for FDA approval for women's devices, and historically and systemically exclusion of women's. We even, as far down as which cells we use in the research, basic scientific research are always male cells. Also, we always use male mice. We never use female mice. And so what drugs are we missing out on for women's health simply because of the sex of things we use in basic research and development? Barriers in business for femtech. There's a lack of medical codes. Endometriosis, 1 in 10 women have it. As of 15 years ago, it was still called hysterica in the billing codes, or hysteria, sorry. And it blows my mind. So we have a lot of work to do there. There's blocked ads. So you can say erectile dysfunction, but you cannot say sexual wellness on Facebook. You have to, Henrietta, yes, she's the case study for the one cell line we use that has 2 X's. Thank you, Brandon. And then we also have the burden of educating the consumer. So a lot of little girls learn about their periods, but they don't, and they learn about pregnancy, but they don't learn about menopause, yet it's half of our life. And so a lot of companies actually have to educate their consumer on what's happening to them. Other barriers, funding. Women historically get less funding as female founders. Male VCs are oftentimes like totally baffled by how many tampons a woman uses in a week during her period, or they're baffled that 1 in 3 women experience incontinence. So 1 in 3 women are walking around slightly peeing their pants every day because of pelvic floor health. So we have an education issue. A lot of our founders are out there spending most of their pitches educating. And then there's this untold story of exits or market sizes. Hopefully that one's getting fixed very soon. So we need awareness, we need investment, we need research, and we need policy change. And so I would love to speak with all of you. I'm going to unshare my screen. My asks for the attendees are, we are seeking donations for FemTech Focus. We're a 501c3 nonprofit and operate off of donations. Also, if you know of any grants or foundations that may be interested in our efforts, happy to take that introduction. I'm also looking for additional speaking engagements, not only to amazing groups like this, but to, Johnson & Johnson, or even oil and gas, because they have women out on the rigs, and thinking about their female employees' health on rigs, I can't even imagine what it would be like to find out you're pregnant on a rig and what resources are not available to you. And so speaking engagements would be really useful for me as well. Subscribing to the podcast, that's the easiest and most fun one. And then Coyote Ventures, we did just open it up. And so happy to speak with anyone that has questions about the fund.
That is awesome, Brittany. Thank you so much for deep diving into so many different areas and topics around that. I mean, talk about a crash course in FinTech. I was going to say, let's open it up to Q&A, and then we can navigate and come up to some various different topics and questions as we continue along too. For members, definitely feel free to pop questions or thoughts in chat, as well as the Q&A function. Or raising your hand as well. We have one over here with Nicholas. So what I wanted to do was actually open it up to you and let you ask your question here for us. So do you want to go ahead and ask your question, Nicholas? You can go ahead and unmute and connect with Brittany here on your thoughts. Hey there, how's it going? Or if you want, I can ask the question for you. Do you have it, Nicholas? If not, I think here Nicholas was asking if you have sound there, feel free to chime in later on, Nicholas. His question was, I noticed that mental health was not covered in detail or represented in the graph. Is that indicative of the activity in that space?
Yeah, so I know of maybe 2 mental health specific femtech companies. A lot of mental health companies are addressing both genders, which I'm a huge advocate for mental health. And so I think that's awesome, addressing all the genders, but we always try to make sure that if we're including something in femtech, it's because they're specifically targeting women. And so that's why it wasn't in depth. There is one app that targets women that are postpartum, and it helps them, it's an app, it's kind of like a concierge service where she can text with somebody and get some advice, but that's one little app in comparison to the millions of women every year that are struggling with postpartum depression. And then the other one is, I think it's called Life Better. I'm going to think about it and I'm going to drop it in the chat, but they are trying to make virtual therapy specifically for women. And I can remember asking them, why would that be different? Why don't you target all the genders? And they said, well, because we want to do, smaller groups where people can get together and do group therapy, and specifically targeting topics that women are struggling with. So, yep, absolutely. So I think that's another place for innovation as well, for sure.
Nice. I'm curious, there's, one of the things, I personally wasn't aware of how just wide ranging that the space is. So, really thank you for that and helping to make me more aware. There's in such a huge space. I'm curious about if there are specific areas that you're personally really interested in or focused in, particularly as you look forward for your own ventures, for the fund, different things like that.
Absolutely, yeah. So we have a few. I helped create a syndicate investment into Prime Genomics. Prime Genomics is the first genetic-based breast cancer test. So currently, breast cancer is diagnosed using imagery. So mammogram is literally just looking at shadows within the breast. And so I think the statistic is about 25% of women that get a mammogram actually get a false positive. So they're told they have to come back to the office and get another ultrasound imagery done. And so most women think, oh my God, I have breast cancer. Oh my God, of course, because why would they think otherwise? And then they realize with the ultrasound, oops, no, you don't. But there's still a percentage even then that get false positives a second time. And then they have to go in for exploratory, getting a biopsy of it. And so Prime Genomics is a functional test looking for markers in the saliva that actually show, metabolites from the breast cancer itself. And so I'm really excited about that. So we made an investment into Prime Genomics. Another company I'm really excited about is called BioMilk. It's actually out of Duke University. They took the cells in the human breast that make human milk. They cell cultured it And now they've programmed it to produce milk in the laboratory. So all the women who are struggling to breastfeed or wanting to buy formula, one day they're going to be able to buy real lab-based human milk. And we can actually engineer the cells to include any kind of antibodies or nutrition that we think. So even NICU babies can get the nutrition they need. So I'm really excited about biomilk. I have a lot I can go through. Those are two.
I was going to say that's extraordinary just to think about that. What I love about that example too is like the multi-generational impact that it carries when we talk about women's health and women's lives as well, type of thing like that. One of the, across the area, you were talking about so many different things around, we have regulatory issues, we have policy and education issues, we have investment dollars as well. Just simple awareness of the space and the incredible work that you, other women in the space and others in general are doing. And when we think about like how to tackle that monumental challenge, I know you're picking up in so many different areas. Could you help us understand a little bit more about some of the things that are happening across that to sort of tackle some of those challenges?
Yeah. So, I have my podcast, which is a great way to speak to literally the world, and innovate or interview people. So we can do through spoken word like that. I find that there's a lot of women of influence now starting to experience, things that they're like, this is BS that I experienced this. So the best example I have for you is Serena Williams. Serena Williams almost died during post childbirth recovery. She said, there's something wrong. And they said, oh no, you've just never had a baby before. You're fine. And she almost went septic and died. And she said, I'm an athlete. I know my body. And the doctors were saying, no, it's normal. And, so Serena Williams actually has a huge voice currently about women's health, doctors believing their female patients when they say something is wrong. So I'm looking forward to more women stepping up and coming out. We now have a woman in the White House, so I hope uteri continue to be a focal point. And that's what I think. We just have to continue to talk from multiple angles, but also we need men. We need men in the conversation, because one of the issues of, I think, why we don't have as much investment, because it's obviously not about the data. Like now we have the data. So why is like they're not billions of dollars flushing through here? And I think it's because a lot of VCs, general partners, are men who would like to invest in things and then go and like tell their friends on the golf course. And when you go and tell your friends on the golf course that you just invested in a new super pad that absorbs menstrual blood 10 times faster, they may not feel educated enough to even talk about that topic. And so we need more men out there talking to other men, just bro to bro, about women's health and women's bodies, because we don't even call the things the right things. It's vulva, not vagina. Like there's, that we have to continue to have this conversation.
Got it. I hate to admit, but I would be a beneficiary of that terminology list if that turns out to be a thing as that you guys do as well.
We should just make a definition list.
Yeah. Bilal, you had a question there. You're welcome to, your mic's available. You can ask Brittany as well.
Yes, Brittany, I'm Bilal. I'm a PhD student here at University of Houston. And I wanted to ask you that what can be done to drive change on the policy level to increase the space for FinTech companies?
Well, all right. Here's my wish, my top 3 wishes.
A huge question. Please, by all means, take it.
How are you going to change the world? All right, now step 1. And I really do change the world. If you can see my tagline, women's health is everyone's health. We don't just birth women, right? We birth male taxpayers as well. So women's health is everyone's health, including the economies and Mother Earth. So anyways, I'll put a pin in that soapbox. So number 1 for policy, we need an Institute of Women's Health. It may sound insane to you, because it sounded insane to me when I learned that the Institute of Women's Health does not exist. So there's about, I think there's like 40 or 50 institutes in the US government that actually can allocate funding and budgets and grant money. So there's the Institute of Infectious Disease, Institute of Cancer, Institute of, heart health. There is no Institute of Women's Health. And so when we try to get grant money, we actually have to get it through another organization and try to weave a story as to why they should care. And so we seriously just need an institute that has its own pot of money that's dedicated to, researching. So many of my FemTech founders spend most of their seed funding on R&D because the science is out. The science is out. We don't even know. So one, we need an Institute of Women's Health. The second one is that we need Medicaid and Medicare to cover more women's health issues. So one of the accessibility issues in FemTech is that we are creating products for affluent white women that can afford an $800 stomach monitor during their pregnancy, and the only way the founders making any traction is that they have to go direct to consumer because there's no billing code for it. So they can't go through insurance. They can't make that business model work. But if we change Medicare and Medicaid to have billing codes that cover more women's health, the rest of the insurers will follow. And then we can actually make products that we have billing codes for, and founders aren't pressured by their investors to go direct to consumer, which is usually just affluent white women. Mm-hmm. That was those are my two. I think those are huge, huge things. So those are my two though.
Those are big. Nice. One of the things, what's most exciting about some of the things that are coming up in the space and things that you're really looking forward to?
One of my favorite things is so two of my favorite things. Number one is that I love the FemTech community. So I've worked in the genetic science community. I've worked in dating. I've worked in oil and gas, right? And so I've worked in like these different industries, and they all have their like pros and cons. But FemTech is a group of people who are insanely driven and passionate about fighting for women's health equality. We all know we are in this together. We all know that there's plenty of money to be made because there's no innovations that are targeting these needs of women. And so it is just the most collaborative community I've ever met. There's no NDA signing. Everyone is just like, I'll trade you this skill for that skill. Like, wow. It's just like such great energy. Everyone is very positive, very optimistic. We are not a group of angry feminists. Like, it's just really, really optimistic and hopeful. And so I personally just love working in this community. I think the other thing I'm really excited about is how willing people are to jump on board. I am used to being a founder that pitches an idea and I get 50 no's before I get a maybe. And, not that, FemTech focus is, we run on essentially a 60-day runway at any given time. But when I do talk to people about FemTech, it's like they get it, and so I feel like the market is super, super ripe for people to get on board, and that it's just an issue that didn't know about it. But as soon as they know, they care. And I think that COVID really highlighted for people that healthcare is not equal for everyone, and that based on where you live, based on your skin tone, like you will have different healthcare services. And so when I say, hey, by the way, that's the same within gender, you get different healthcare. People are like, oh, I've heard about this. Inequalities in healthcare, I've heard about this. So people have been really receptive to what we're trying to do.
Yeah. Let alone the fact that we're just starting to get involved on things like social indicators of health, let alone just like health problems themselves. To bring us back around to as well, different ways that we can get in touch with you and get involved. So I saw you shared your LinkedIn info. Appreciate that very much. You have your website, you have your podcast. Tell us a little bit more about different ways we can connect with you and get involved.
Yeah. Oops. My dog's trying to jump on my lap. Come on. He hit the keyboard instead. Poor little guy. by the way, I found the link to the mental health app specifically for women. I'm going to drop that in the chat.
Sure.
Yeah, best way to get in touch with me, honestly, is email Brittany@femtechfocus.org or Brittany@coyote.ventures. You can sign up for our newsletter at femtechfocus.org, and then you'll know about all the events that we have and the different things coming up. Follow me on LinkedIn. I'm really active, and I like to think I share relevant things. So you can follow me on LinkedIn for that information, and just, do me a favor and tell 2 other people to follow Femtech Focus. Share the podcast with a female in your life, share it with, a man in your life, and share it with an innovator or an investor, and just say, hey, I think this is like the next big thing. And I think this is really important. And it's not just social impact, it's actually really smart investment. And if anyone's interested, happy to talk to them more.
You also popped up on my screen the other day. Clubhouse said you are leading an event over there. It sounded like you might have some regular events over there too as well.
Yeah. So if anyone here is on Clubhouse, I'm often on Clubhouse. Every Thursday afternoon about 3 o'clock Eastern, so 2 o'clock your time, I host office hours where I just kind of open up a room and people from around the world tune in and ask me questions or pitch me their companies. And it's really fun. It's very fun.
Awesome. Thank you so much. Really wonderful to have you again with us in Open. Of course, we'll be in close contact and look forward to having you again as well in the future, and wish you the best of luck in your ongoing journeys.
Thank you very much. Yeah, looking forward to hearing from y'all.
Absolutely. Thank you so much, Brittany.
Bye.
Bye. Thank you everyone for joining with us today. Really great event. If you need any information, feel free to reach out to me and I'd be happy to connect you guys over to Brittany. My email's in the chat and so is my number. And wish you guys a great Thursday evening. Take care, everyone. Bye.